Hello friends, this is Dr. Ajay Vikram Singh. Welcome you all, and I'm thankful for you to take out your valuable time to watch this video. It's my request, please watch this video till end, and we are going to talk about dental implant technique and the experience of our one of our thorough gentle the patient who came all the way from US to get our implant done, and how he experienced after the full mouth implant. He's going to share experience with us, so please watch this video till end. Thank you.
I live in the United States.
Okay, and you contacted me for your dental problems, and you said I have lost a couple of the upper teeth and all lower teeth, and I'm wearing some dentures since couple of years, and and now I want the fixed one, okay, because denture is also not working well, and then when you came to me, I got to know upper multiple of upper teeth was also got damaged. So now in short, we have extracted all the teeth, and we have fixed we have given the fixed teeth over the implants in the upper and lower jaw, and the whole procedure, entire procedure took around a week of time, or maybe the 10 days, okay, and in 10 days we have removed all the teeth, we put the implants, all implants, and given the fixed teeth over the implants. Now you have chewed, okay, and what you have chewed from the new teeth, and how you feel?
Yeah, I would like to start from the beginning. That I happened to came to know about Dr. Ajay from the YouTube channels and all that, and I shortlisted him from amongst the hundreds of videos that I might have seen of for the last year or so, and I was thinking that I only have a problem with the lower jaw and a few teeth, missing teeth in the upper. But the Dr. Ajay suggested me that the both of these, they cannot go together, they cannot work together. And the upper jaw, which I was thinking that it was a very good position or situation, but after having seen the CDVT and the X-ray, he arrived at the decision that that is not as in good a position as I am thinking about that. So in short, he has done my, I would say, entire overhauling, removed all teeth altogether, and have done, in his language they call it full mouth rehabilitation, and he has done in such a record time, in such a fine manner, in such a precision, and with such a concern, and with such a humane touch, and it can well be said that he performed where most of people call it a painless procedure surgery, but his was actually painless, meaning the word-to-word training. And my the treatment got accomplished day before yesterday, Thursday, and today it's Saturday. For the doctor preferred that to keep me under at least 2 days observation. So I am with him after 2 days observation. For the last 2 days, I have eaten all kinds of Indian and continental food. I started it when my teeth got done on Thursday, day for yesterday, and I started with fish, and then chili chicken, and then the tandoori chicken, and then all kinds of the Indian dishes and all that, and then the pizza, then the pasta, and then lasagna in my new hotel. And right now, after say it was about about an hour ago, that I chewed and enjoyed lamb chops, which is a hardcore non-veg dish, So I mean to say that when I can chew and munch and all these things, so except for nuts, I have eaten. The doctor cautioned me not to go in for the nuts. I don't know, but I didn't go for nuts. But everything I am able to chew, eat, enjoy as if I have natural teeth. And after a long time, I'm feeling myself a new man, newborn, with a new spirit. And at least now I can say that I can eat anything and I can enjoy anything. And he has made my life like a new one, and I really feel like a rejuvenated person. I'm 63 plus, and I am also have a pre-existing medical condition with pacemaker. But even then, he went so cautiously, so carefully, and so much doctor-like that I have no words for it. I'm highly thankful to him.
Thank you, sir. Sir, one point which I want to discuss with you. We started the dental tourism in around in 2003 to 2004,
Right.
and we treated so many, the patients from around the world, from US, Europe, and NRI patients as well. After a couple of years, what we actually, because there was only couple of the implant dentists in India who was able to do, the very good implant surgery, and among them, I was among them, one of them. And after that, there are so many, the dentists in every street. They started, the placing implant and putting the teeth, and there's a simple procedures they are able to do. I don't deny, but the full mouth rehabilitation or the implant itself is a complicated procedure. It's not in a general dentistry, the procedure. So what we notice after a couple of years, the patient who are coming from abroad, sometimes they feel they contact couple of the dentists there in India, and they choose the cheapest one who is there to place an implant at the cheapest cost. I always suggest them, already you saving a lot of cost, and you need not to compromise in the the quality. Your motive is to get that quality of work which is being done there in US or Europe at affordable cost. If you reduce at the very high in the cost, if someone is reducing very high, then obviously he will compromise in the the quality. So those people are not that much skilled, and then the patient feel a lot of problems. So I always suggest, what you will say to such patients when they choose a right dentist, and how they can choose a right dentist in India, because there are so many dentists, so many techniques, so many some people say I'm able to do it at this cost, some people I'm able to do it at this cost. How what are your points to ponder on this, being a the very the like intelligent, like educated.
The doctor's question is very appropriate in this context. When the people come from abroad, particularly from the US people are very simple people. They think we are going to India, so they think that each and every dentist can do the job for which I have come here for, and when they phone or call a couple of people or 4 or 5 people, they think that the cheapest one is the best one. And they think that the treatment is the same, but this particular doctor is charging me, so much amount. So they go in for that, but they don't understand. No, in India also there is a different, the type of treatment, and the difference in cost is not just the cost; it is the quality. It's the quality of the work, the way I had come to the doctor, I had explained him that there is a clinic, they claim to be the 5-star clinic, and they only emphasize, they only show on the YouTube their clinic, their architecture, what we have to do with that? I'm a patient, I have to get treated on the dentist chair, not by the clinic, not by the music, not by the massage chair. So we need a 5-star doctor. The people those who come from the USA, they must understand that each and every, particularly before saying anything, I would say every dentist is not implantologist, and there should be some some law that every dentist should not be allowed to perform implants.
Yes.
Though legally they are allowed, it should not be. In the USA, it is not like that.
Yes.
I mean, the implantology is a very high kind of, not just specialization, a very superior kind of specialization.
Yes.
And with Dr. Ajay, I would say that I have seen him, I observed him, that he has a passion for, he likes to implant. This establishment, most dentists in India, they only have this much amount for the entire, in their clinic where they perform all kind of things. Here, this much, which I have observed for the last 7 days treatment he worked on me, that this much, establishment or this area is just meant for implants, implantology. So, And he knows what is what, and he likes to implant. He takes pleasure in doing implantation, unlike many others. I don't mean to say that he's the only one, but don't just go for the cost. Go for the
skills of the dentist and what
Right.
kind of the setup he
Right.
has, how much experience he's in implantology,
Right.
what kind of patients he treat,
Yeah.
what techniques he is able to perform,
Yeah.
and what is the past experience of the other the patients from him, the particular dentist. So these are the things which need to be considered, not like if someone is saying I'm able to do it at just this cost and you just
But-
just go for it.
But I would say one thing, it is obvious that what is the reason? Because doctor, when he's a doctor, he's busy. He cannot make video every other day.
Yes.
The last video which I saw about him was 5 months ago.
Yes.
And so his road show or his advertisement is not that much. That's why people don't
Yes.
happen to know about him.
Yes, yes,
And I would say that I would suggest to him that hire some professional and post your videos in a manner. I mean, so that people may come to know what is the difference.
Yes, yes. I know this.
Yeah.
Yeah. I will definitely look into it. So thank you, sir. And I'm very thankful to you too for being a very like a fantastic patient, very cooperative, thorough gentleman, and we really appreciate your cooperation. And good luck, and chew your food of your choice, and go ahead in life.
Thank you. Thank you, doctor. Thank you. So nice of you. Thank you.